the milk which is secreted by these epithelial cells of the alveoli travel through these small ducts, then these larger segmental ducts, and finally travel through the main duct, and milk before secretion or before it is sucked by the newborn, it is stored in the sinuses. These sinuses milk before its ejection first of all, the milk is stored here in the alveoli, and finally the milk is stored here. This dilated part of the lactiferous duct is known as lactiferous sinus. So this is known as lactiferous sinus. The newborn male and female babies are having, not always, sometimes male or the female babies are having secretion from the lactiferous ducts in the initial few days of the birth. Under influence of the maternal estrogen hormone, this fat-free secretion is known as witch's milk. So there is secretion of fat-free milk or fluid known as witch's milk. This witch's milk is very anxious for the parents of the newborn. They are confused the secretion by some serious underlying pathology, but this is self-limiting, and when the level of maternal hormone which is circulating in the newborn's blood declines, or it is set at the level where it is not capable to secrete the secretion which is fat free or witch's milk, it will subside within some days. Now, after the glandular tissue, there is the stroma. After glandular tissue, there is a stroma. The stroma is a connective tissue, and it is having mainly two components. The first component is the fibrous stroma, and the second component is the fatty tissue. The fibrous stroma, and the second is the fatty stroma. When it is loose, areolar fat. So what happens? The breast are having the skin which is having the nipple and areola. It is having the glandular tissue which is a compound tubulo-alveolar type of the apocrine gland which is having two types of vacuoles. the protein vacuole which secrete the lactalbumin and casein, and the fat vacuole which secrete the fatty component of the milk. The supporting tissue of the breast which anchor and support the skin from the underlying pectoral fascia, which also support the glandular tissue to the pectoral muscle and pectoral fascia, and which also form the interlobular compartment for the glandular tissue. As we all know, breast is having 15 to 20 lobes. These lobes are divided or separated by the fibrous septa. These septa are formed by the fibrous stroma. So again, the pectoralis major muscle, the covering pectoral fascia, and this is the breast. This space between the deep fascia and the base of the breast, this space is filled by very loose areolar connective tissue. This tissue allows the breast to move on the pectoral muscle or the chest wall, and this space is known as retromammary space. This is space filled it with loose areolar connective tissue. Behind this retromammary space, there is the deep fascia. This deep fascia is also known as pectoral fascia. Then the underlying muscle, the pectoralis major muscle, here it is, the pectoralis major muscle. So when we see from inside to outside, first of all there are ribs which are having intercostal spaces which are filled by the muscles, the external and internal and innermost intercostal muscles. Outside the ribs there is the muscle. The underlying muscle, mainly pectoralis major, some other muscles are also forming the bed of the breast. The serratus anterior and aponeurosis of the external oblique muscle of the abdomen, which separates the base of the breast to the rectus abdominis muscle in infero-medial part of the breast. Then the deep fascia of the pectoral region, known as the pectoral fascia. This fascia is anchored by the periosteum of the clavicle and the sternum. Finally, there is the breast tissue. Which is having the lobes which are again divided in the lobules. So, here we can see clearly the lobules. There are 15 to 20 lobes. These lobes are having the glandular tissue or the parenchyma of the breast, and these are the skin, the glandular tissue, and the stroma, the fatty tissue, so the skin of the breast, the lobes of the glands, all are anchored by the fibrous stroma of the breast. Simply, the fibrous stroma is a modification of the superficial fascia. Remember always, the breast or the mammary glands are lying inside the superficial fascia. So, this is the deep fascia, and these are the condensed modification of the superficial fascia are anchoring the skin, the glandular tissue, and the fatty stroma of the breast. Besides anchoring and supporting the skin and the glands, it is also forming these ligaments. These ligaments are known as the suspensory ligament of the Cooper. So, these are the suspensory ligaments of the Cooper. These fibrous condensed ligaments anchor the glands, the skin of the nipple and areola. When there is some carcinoma of the breast, there is thickening of these suspensory ligaments and formation of the dimple. This dimpling of the skin of the breast, when these are multiple and resembles the outer surface of the orange, these are known as pudgy orange appearance. Pudgy orange appearance. So, the fibrous stroma is anchoring the skin the mammary glands, and it is also forming interlobar septa. It is also forming interlobar septa. So these are the interlobar septa, which are delineating the one lobe to the other lobe. So there are formation of 15 to 20 lobes, and these are radiating to the nipple and having openings through the lactiferous ducts. So this is the stroma of the breast. Now I will talk about the blood supply, the nerve supply, the venous drainage, and the lymphatic drainage, which is having not only importance or significance for clinicians, anatomists, surgeons, but also having a great importance for the clinical practice and the radiotherapy. So this is the breast, outline of the right breast. When we talk about the blood supply, the clavicle, and this is the coracoid process of the scapula. And these are the boundaries of the pectoralis minor muscle. Minor muscle. This is the first rib. The second rib. This is the subclavian artery. Subclavian artery, and when this artery comes out or lateral to the outer border of the first rib, the name of the artery is changed. Now it is known as axillary artery. So one artery, three names: subclavian, axillary, and brachial artery. This is the subclavian part, the axillary, Here the pectoralis major muscle is the key muscle of the region, which is dividing the axillary artery in first part, second part and the third part. This is the first part. Behind the pectoralis minor muscle, the second part, and finally when the artery comes out to the lateral and inferior part of the pectoralis minor, we can see the third part of the axillary artery. And this is the outline of the internal thoracic or internal mammary artery. Also known as internal mammary artery. This is the superior thoracic artery arising from the first part of the axillary artery. On the lateral and inferior border of the pectoralis minor, there is a branch of the second part known as lateral thoracic artery. Behind the pectoralis minor muscle, one more artery which is also taking origin from the second part, known as thoracoacromial or acromiothoracic artery. These all arteries, the superior thoracic, the branch of the acromiothoracic or thoracoacromial artery, and the branches of the lateral thoracic artery, all are supplying blood to the upper and the lateral part of the breast or the mammary gland. Now, medial part. Is supplied by the perforating branches of the second, third and the fourth intercostal branches of the internal thoracic or internal mammary artery. The inferolateral part is supplied by the perforating branches of the posterior intercostal arteries. So these are the lateral branches of the posterior intercostal arteries. These arteries, second, third and fourth, are large in females but smaller in males, because they have to supply the blood to the large and lactating breast at the time of the pregnancy and the childbirth. So these are enlarged arteries known as mammary arteries. branches of the internal thoracic or internal mammary artery, and the branches, perforating branches of the posterior intercostal arteries. So, this was the vascular supply of the breast. After a short break, I will talk about the venous drainage, the nerve supply or innervation, and the very important part, the lymphatic drainage of the breast.